Hi everyone, welcome to another episode of Scottish Drugs Forum's COVID webinars. We're not on a podcast today. The plan for today is to talk all about naloxone developments in Scotland during COVID and beyond, and we've got some great speakers lined up for you today. Just to mention as well that today, the 26th of June, is also the global campaign for the Support Don't Punish work that's happening around the world. It is basically to advocate for harm reduction and drug policies based in public health and human rights. If you haven't already signed up to support that, please do check out their website to see how you can get involved at supportdon'tpunish.org. If you're new to GoToWebinar, you will see that on the right-hand side of your screen, normally you've got the panel there. So during the 4 presentations that we've got today, you can input your questions into that box. The questions aren't seen publicly, but they are managed in the background by Austin Smith, who'll be joining me at the end to get those questions asked to the people we have speaking today. So the plan for today is that we have 4 people speaking who I'll introduce in a moment, and they'll all have 10 minutes each to give their presentations. After all 4 presentations are done, we'll get everybody back on screen and we'll have the questions. So just to introduce the topic for today, the Lord Advocate statement on prosecution policy was introduced in Scotland on the 27th of April, and I just wanted to explain a bit about what that means for Scotland and how we've managed to use that to develop things a bit here. So the UK regulations for naloxone currently state that anyone who is a drug treatment service can provide naloxone to people who are likely to witness an overdose. And that regulation was updated in 2015, so it meant that third sector drug services, peers and others could also supply naloxone kits. It hasn't affected at all who can administer naloxone in an emergency. That can still be done by anyone for the purpose of saving a life. So that was a great development, but what was missing from that and what was becoming and still is problematic is that it meant for services that were in contact regularly with people likely to witness an overdose that they didn't necessarily have it within their powers to be able to supply kits. So they could administer it in an emergency, but they couldn't supply it. So I'm thinking services like homelessness services, the criminal justice service, family support services, were all in a position where they had to signpost people to get an actual physical naloxone kit. So when the lockdown commenced, we had some discussions with Scottish Government and asked that the Crown Office were approached to speak to the Lord Advocate, who's the Chief Legal Officer in Scotland, to put together a statement that would allow any service in contact with people at risk of witnessing an overdose or at risk of an overdose themselves to be able to supply kits, so services like the ones that I've just mentioned. So it's called a statement of prosecution policy that is now in place. It has been made quite clear that that statement will only be in place temporarily while the COVID crisis is with us. So we really need to make the case for that to become existing UK regulation, and we would want that to be a UK-wide policy that not just drug services are in a position to supply it. So we've got some great examples of how we've managed to use that regulation change. And we have Sarah Donaldson, who's a specialist pharmacist for substance use in NHS Tayside, who's going to join us first. So I'll just invite Sarah on to join me just now. So Sarah, over to you.
Hi there. Okay, thank you very much for that, Kirsten. So yes, I'm Sarah Donaldson from NHS Tayside, and I am the naloxone lead for Tayside. And I'm going to talk to you a little bit about how we've used this Lord Advocate's letter to extend the naloxone programme in Tayside and kind of where it fits and the opportunities that gives us across Tayside. So just to give you a brief overview of the services that have currently been participating within Tayside for naloxone, we've developed it over the years since 2011, since the introduction of the Scottish National Programme. So we have statutory services, so prescribing services have been giving out naloxone and training people in overdose awareness. We have our third sector partners who have been crucial during this time of COVID to make sure that we're sustaining supplies of naloxone across Tayside. So just to give you a few examples, they have developed the Postal Naloxone service. they have been out and about doing OST deliveries and taking that opportunity to deliver naloxone on people's doorsteps. We've had other third sector partners, for want of a better description, crowd control outside some pharmacies and taking the opportunity to talk to people about overdose, making supplies of kits, and seeing if people need any further support from there as well. So they've been absolutely fantastic during this time. We also have our amazing volunteers and peers that work within the third sector, and they are also a crucial part of this. And we have a development day next week to look at how we can support and develop that a bit further. We've also had a community event within Dundee, the Dundee Hope Festival, and that was an event that was put on by a whole host of partner agencies. And during that event, we had naloxone supply and overdose awareness training for members of the community who are likely to be present at the scene of an opiate overdose. Now, that was really positively received by the community, and the feedback that we got was that the community want greater knowledge about overdose and they want access to supplies of naloxone. And we know that overdose obviously devastates families, it devastates communities, and we really do need this community-wide response if we're really going to address it. But we've always had this issue of how do we normalise these conversations and reach beyond traditional drug services and actually recognise that everybody has a role to play in overdose prevention. And I think this is the key part where these non-drug treatment services really come into their own and provide us with this opportunity. Could I have the next slide, please, Andy? Brilliant, thank you. So as Kirsten has said, the Lord Advocate's letter was issued on the 27th of April. We knew that this was likely to happen a couple of weeks before that. So there was this kind of enthusiasm and talk about it within Tayside. And I have to say it was met with enthusiasm within Tayside. So we already had non-drug treatment services that were trained to be able to get people to recognise overdose and be able to explain how to use naloxone, but they couldn't do that final step. And that was really important because we know no matter how good we train somebody, if they don't actually get that kit in their hand, the chances are they're not going to get a kit. So as soon as there was a whisper of this on the horizon, I had non-drug treatment services getting in touch with me to say we were absolutely up for this. So it really hasn't been a hard sell at all in Tayside, and certainly as a naloxone coordinator, it's made my life very easy. And the feedback that we're getting from the services that are registered to do this at the moment is it's very warmly received with their staff members and also the people that they are reaching as well. I think it's really important that we recognise that a lot of these services already have a lot of experience with naloxone. So a lot of them hold naloxone in their first aid kits, they will have had to deal with overdoses and actually have that administration experience, and that's absolutely vital when you're training somebody. That's not something that we can teach somebody. So it's really recognising that actually progressing to that step of being able to make supplies isn't a huge step for a lot of these services. Now, during training, we talk a lot about changing your message. So if somebody isn't accepting a naloxone kit and that advice, change your message. And that's absolutely right. But we do recognise that sometimes it is about the right person at the right place at the right time asking you and having that relationship and conversation with you. So the more services that we have involved, the greater the chance we have of getting kits to the right place, and every single kit that we get out there is a potential to save somebody's life. And could I have the next slide, please, Andy? Perfect, thank you. So just looking at a bit of the preparation that we did in Tayside for this. So as soon as we knew it was coming, we sent a paper to each of the 3 ADPs within Tayside to start this conversation, to explain what it means for the Tayside naloxone programme, and also to ask for their help. Because this is a really key point, is recognising that whilst as an naloxone lead I have contacts within other drug treatment services and I might be aware of the work of other non-drug treatment services, I don't really fully understand exactly where they fit. So it is very much a team approach, and we do really need ADPs to help identify services and have those conversations. We take a Tayside-wide approach, so it shouldn't matter where in Tayside you are, it shouldn't matter who supplies a kit to you or which service. You should get the same advice, you should get the same quality, and you should get access to the same supplies. So we have the same governance framework across all services, whether that's statutory, whether it's third sector, or whether or not it's the non-drug treatment services. So that's things like the training requirements for staff, it's the recording requirements, so we know which staff are trained and able to make supplies, and also that reporting requirements back to us that we can inform information services how many kits that we're actually supplying. And it's very much a team approach. So we took the decision very early on that we wouldn't view these non-drug treatment services just as a temporarily additional measure. They would be very much part of the programme, the same as every other service, and that they have input and influence on the programme. So they will be invited to further training and catch-up meetings that we have. And there's also part about resilience, so it's making sure that the Naloxone programme in Tayside is resilience. So it's things like having a generic email address for Naloxone, so that should I get COVID, if all of the emails are coming to me, there shouldn't be a delay with progressing with this service. Could we just go to the next slide, please? Perfect. So just a couple of things that we put into place. So previously, prior to COVID, training, so T4T stands for training for trainers, so it becomes a bit of a mouthful, so it's easier just to say T4T. So we very quickly had to move online because we couldn't do this face-to-face one-day training that we did prior to COVID. So we're very fortunate that the Scottish Drugs Forum e-learning module was already there. It's really comprehensive. It's a chance for people to answer questions and demonstrate that they have knowledge and understanding, and really crucially have that certificate to say that they have been trained. So that was fantastic, but we also needed to look at how we're going to train people in the local context to make sure that everybody was meeting the requirements with paperwork returns locally. So we had a few considerations for that. So we considered a webinar, which like this, which is great, so you can answer questions. But we do recognise that actually some of these non-drug treatment services don't work Monday to Friday 9 till 5. So that becomes quite difficult to make sure that we're providing enough webinars to capture that. So working with public health colleagues, we developed a video. It's a very short video, and it very briefly goes through the local context, what the picture of Tayside looks like, and also how to return the paperwork to us and what we need the services to tell us. We then developed an information pack because we recognised that it was really important that services had all of this information to get up and running in one place, and everything was as smooth as possible. And that includes information about how to register. It's really important that they register with local Naloxone leads so that they can be registered with the Scottish Government, because that is how they are covered by the Lord Advocate's letter. And it also sets out a minimum training requirement so that we're making sure that there's good governance across the programme. We also set out what record keeping that these services need to keep. So again, it's good governance and making sure that we're getting all of the information that we need to evidence that this is a good route to go down for Naloxone supplies. And just the next slide, please, Andy. Okay, and just to finish with just looking at the next steps for the programme within Tayside. So we did have a few organisations that got in touch in the early stages to say we'd be really interested in this, but haven't actually progressed to register. So we're going to pick up with those and check to see what further support we need to be able to provide these services to progress. We really recognise that communication is really vital in this, and particularly as the programme is becoming more complex and the more services involved. So we need to have a one-stop shop for information. So whether that's for the public, so that they can easily access information about where they can get Naloxone, but also staff as well. So all of the tools that they need are all in one place and really easy to access. I mentioned the catch-up meetings just briefly. So we have quarterly catch-up meetings, and we have done so for a number of years. And that's a chance for peer support and to build those connections between the services. But it also gives services an opportunity to give ideas and influence a programme as that develops. And for me as a Naloxone lead, it's really important that I'm getting that feedback to make sure that we are supporting services and that there aren't any gaps. We also need to build on the training available. So clearly COVID restricted how we delivered training and forced us to go online. And for some people, that's absolutely the right way to train them. But we do recognise that some people don't like online training. So as kind of things ease up, we need to be more flexible and look at all of the various different training options available to us. And just finally, we need to review. So we need to review who is participating. Are there any gaps? So it's that constant communication with ADPs to check that we're capturing all of these services and getting them all engaged with the service. We need to review the supplies. So when that data is coming back in, that's going to give us some really valuable information. For example, is it all resupplies, or is it new supplies? And are the new supplies people that we've never actually managed to catch before? And that's going to be really important evidence to prove how important this is. And finally, we need to review how we support these services coming on board and make sure that they very much do feel part of the programme and that they are able to take part in reducing overdose within our communities. So that's the end of my talk. I hope that was interesting for you. Any services in Tayside that are listening, if you're not involved, please do get in touch with me. I'd be delighted to hear from you. Thank you.
Brilliant, thanks a lot, Sarah. That's awesome. So really great work happening over in Tayside. And I should have probably mentioned as well that just at the start, when we had some issues with the Lord Advocate letter, there was a slight omission from that created some issues around the supply chain. So this was for NHS services to be able to provide these non-drug treatment services with naloxone for onward distribution. So there was a bit of back and forward with the Crown Office to ensure that that was actually covered as well. So thankfully that has now been resolved, so we can get on with that. But Scottish Drugs Forum was given some funding from Scottish Government to facilitate some provision of naloxone kits for these new ways of working. So we were really happy to be able to support some of that work as well. So thanks very much, Sarah. We're just going to move on now. We'll come back to you later for questions. So also, if you see a little cursor moving about in the background, it's not because any of our staff behind the scenes are playing around with a computer system. It's just because we have to move your questions around. So don't worry if that's if you see that. So we're going to move on. We're moving away from Tayside now, moving over to Lothian, and we've got Susan Grant here with us, who is Programme Coordinator for the Salvation Army Homelessness Services. So thanks, Susan, and over to you.
Thanks, Kirsten, and thanks for inviting me along to speak today. My name's Susan and I'm the Programme Coordinator at the District Wellbeing Centre. The Wellbeing Centre is part of the Salvation Army's homeless services within Edinburgh, and today I just want to talk a little bit about how the service has developed over the last couple of years, some of the barriers we faced when we weren't able to give out naloxone to people that we work with, and just some of the changes that's happened since COVID, and now that we can give naloxone out. Next slide, please, Andy. So the Wellbeing Centre has been through quite a period of development over the last 2 years. We were a brand new team, and we were also at that point working alongside Stirling University within a SHARP study, which was looking at harm reduction through peer support. And what we wanted to do was develop the day centre into a trauma-informed service. And we wanted to be quite intentional with that. So we looked at the concept of meeting people where they're at. We looked at relationships and how we could fulfill therapeutic relationships and build connections with the people that we're supporting. And what really came from that was harm reduction was key. Harm reduction meaning respect, dignity and compassion. Having the peer navigators and their lived experience was really integral to the development of the Wellbeing Centre, and we were able to use their experiences of using services and some of the barriers that they faced. And one of the biggest barriers they spoke about was the power imbalance between services and those who use services. So we used that and we wanted to create a service around co-production, a service where people feel valued and they feel part of something. In the district, we don't call it co-production, though we call it squad goals. We wanted to create a programme with psychosocial interventions. Training, staff training was really important. We accessed training from the harm reduction team at Spittle Street, the excellent training from the Scottish Drugs Forum, but most of our training came internally from the addictions team within the Salvation Army, and reflective practice was also really important to the development of the service. Next slide, please, Andy. So this is some of the programme that we have at Nidri Street. So we have a real mix of different activities, including therapeutic, trauma-informed yoga. We have a women's service. We have external agencies who come in, and we have CGL who would provide a drop-in once a month, and they would give out naloxone within the centre. We also have a really excellent relationship with the Edinburgh Access Practice, and we have outreach pharmacists that come in weekly who also can give naloxone out. We provide one-to-one support. We also have, as part of the Salvation Army's addiction strategy, we run our psychosocial programme, which is a programme that just supports people to look at the challenges that they face in their life and some of the coping strategies that they can have to reduce harm. Next slide, please, Andy. So harm reduction is a big part of what we do within the centre, and in November last year, in partnership with our colleagues from the Salvation Army Street Project, the SDF team and our parish nurse, we launched our harm reduction van on a Wednesday afternoon outside the Nudgee Street Wellbeing Centre. This was really supported by the NHS, by Police Scotland and Edinburgh City Council. Next slide, please, Andy. And although we were delivering the psychosocial programme, and although we had the harm reduction van, we were not a commissioned drug service, so we were not able to give out naloxone, which caused an awful lot of frustrations for us. We were advised that it was great to train people, however, we had to signpost just because of the legislation. This did pose some challenges for us and for the individuals that we're working with. Within the centre, not everybody that we're working with is access the services that distribute take-home naloxone. There was definitely, we would often get asked if we had naloxone and the people were not able to get it there and then when they needed it. We're a very small team, so it wasn't always possible for us to take people along to services that they could access naloxone from. Fear, judgment and stigma really was a big part to play in this. I'm going to go on to talk about that a bit later, just about the impact of that, and that was a real barrier for people accessing naloxone. That's what we were getting fed back. There was also some people would feedback that they didn't feel comfortable going to access some services. There might be people there that they wanted to avoid, so that would stop them going to them. And they also spoke about that fear that if they were to access naloxone, that it might impact on their prescription, on their script. But I think for us, one of the biggest challenges was that we were so happy that we were able to provide the needle exchange, but it just did not make any sense at all that although we had the needle exchange, we were not able to give out naloxone along with the IEP. Next slide, please, Andy. One of our PR navigators, Wes, wrote a really powerful blog for International Overdose Awareness Day last year. And I thought it was important to add it into the presentation, because I think what he's saying really sums up how I believe third sector organisations can feel when you know that people are at so much risk. And he speaks about, so what can I do? I can continue to observe, buddy, administer naloxone to service users, but often watch as they stumble away from a service with a mate or two, knowing that none of them has a kit, and hoping beyond hope that they don't need it. I would definitely recommend that you have a look at that blog. It's really powerful. Next slide, please, Andy. So COVID came along and turned our service upside down, and we had to adapt very, very quickly. We're not able to provide the day centre service as it was before. And one of the biggest priorities as a team that we highlighted was the need to upscale our harm reduction. So we brought the needle exchange from the harm reduction van into the centre, and that was supported from our colleagues at Spittal Street Harm Reduction team. We worked with the NHS, and very quickly we had a rapid access to OST outreach drop-in run by Joe Tay and Lynn Drysdale. The staff team worked so hard, making lots of telephone calls to people. In the beginning, it was a lot of crisis intervention, checking that people were okay, did they need to access the outreach drop-in, did they have food? One of our biggest concerns was that the groups were so well received, and we wanted to stay connected with people. So we were really lucky and managed to get some funding from the Scottish Recovery Consortium to allow us to be able to continue our groups. We weren't really sure how that would work, but the biopsychosocial programme is still running twice a week virtually, and so is our women's group. We kept in space for one-to-one appointments for people, and staff training was ongoing throughout as well. Next slide, please, Andy. So this is a poster here for our psychosocial programme. And next slide. So the changes came, which was great, and we were supported by Andrew O'Donnell, the Naloxone lead for Lothian, to implement take-home naloxone within the service, and this all happened very, very quickly. I met with Andrew, and he went over the training that would need to be given to allow me to train staff. He went over the naloxone framework, the recording that we had to do, the staff competency checklists. But to be honest, the staff training was actually the easiest part of implementing take-home naloxone, because just like mentioned before, they were already really knowledgeable through training. The SDF training is part of our learning pathways, but also through their own experience of having to administer naloxone. The addictions team within our own organisation very, very quickly were so supportive and very quickly supported us to implement local procedures and policies so that we could distribute naloxone. So we were able to do that from the Wellbeing Centre with social distancing and PPE, and we also did some outreach to the Pleasance, which is our hostel in Edinburgh, again with social distancing and PPE. Next slide, please, Andy. I think quite naively, we assumed that as soon as we were able to give naloxone out, that we would be giving out lots each day that we were open. But actually that's not what we found. We found that there was still a bit of resistance from people. And when we explored that a little bit further, we really felt that stigma was driving that actually people spoke about being offended. Why are you asking me if I need naloxone? I'm not using heroin, and just that judgment and stigma that's been created through society and services for a long time. So we looked at how we can try and combat that. So we have upped our harm reduction conversations. Just the other week there, a gentleman had said that he doesn't need naloxone because he is not using heroin. However, he spoke in detail about his increased benzo use. So we're able to have lots of harm reduction conversations around that and about polydrug use. We really wanted to take a compassionate approach to combating this stigma and the stigma and the shame that people who use drugs experience. And our lovely friends from Rosa Loves Rainbows had made this print here for us. So we made t-shirts and we made posters, and we wanted to almost, instead of people feeling embarrassed or shameful about accessing naloxone, we wanted to turn it into something positive, something powerful, and something to be proud of. And part of that was lots of positive reinforcement if people were talking about they have administered naloxone and just how amazing that is. Next slide, please, Andy. So we've distributed 29 kits. We've trained 9 people who have never been trained in it before, and 11 people have came back and said that they've used naloxone, which is amazing if that's what we can do during COVID. Next slide, please, Andy. And just beyond COVID, we're actually involved with Stirling University at the moment, and we're looking at a learning lessons study just about some of the changes that have happened and what we would look to keep in the future. We really do hope that being able to give out naloxone is here to stay, and I guess a real dream of ours would be just in line with the co-production part of Nudgey Street, that we'd be able to develop a peer-to-peer naloxone programme similar to the amazing stuff that's happening out in Glasgow and the work that Tracy, Clusker and Malky are doing out in Midlothian just now. And that's me.
Thanks, Susan, that's awesome. So yeah, really great work. I'm so glad that you guys are finally able to distribute naloxone now. It's been a long time coming for you. So thanks a lot, and we'll just move on until we come back to you for questions at the end. So I'm going to move over to a national perspective now, and we've got Suzie Gallagher from Scottish Families Affected by Alcohol and Drugs. Suze is the Helpline Development Officer for SFAD, and she's going to talk to you about the fantastic work that they've been doing around the helpline and the naloxone postal service. So Suze, over to you.
Thanks, Kirsten. So through Scottish Families, we've got our national helpline, which is for people who are concerned about somebody else's substance use, but we do regularly get people who use substances coming through that looking for support for themselves, generally because it's a free phone number and they always get an answer from somebody there who's there to help them and give them information on how they can access services. So through our helpline, we regularly have conversations about the signs and symptoms of overdose with family members. We see families very much as a strength in protecting drug-related death, and we struggle with the fact that generally when we talk about drug-related deaths or near fatal overdoses, we talk about families, it's those poor wee families, and it's a shame for those that have lost individuals. When we see them on a flip side of that, we really do see them as a strength and something, you know, to be used to try and prevent the drug-related deaths, to see them as a protective factor. So for naloxone, our contacts that come through our helpline, about 23% of them are opioid related, and we regularly have conversations with family members with regards to signs and symptoms of overdose and how to access naloxone, you know. But the frustrating thing is that we regularly have to say to family members, and here's where you need to go and get it. So there's a barrier there for families, the stigma associated with going to a treatment service or going to a community pharmacy to disclose that they need naloxone. In rural and remote communities where we support a lot of family members, you know, there is a huge stigma associated with that going somewhere else. So even in our family support services, where we've got our family support workers, we've got a commission service and they're there to support families and can provide training on naloxone, but we couldn't actually physically provide a kit. We had to then say, you need to go to a treatment service or you need to go to such and such a pharmacy and go and collect your own. We don't know then if those family members ever go and get those kits. So we're investing time and effort in to try and prevent that drug-related death, but the stigma could be preventing families from accessing that vital piece of kit. The thing with us, our helpline's open till 11 o'clock at night. We provide a helpline service 365 days of the year. We regularly get contacts through, you know, through the Christmas period, public holidays, where people really could be benefiting from accessing a naloxone kit, but pharmacies are closed, treatment services are closed, and there's just not that way for them to be able to get it. It's quite frustrating that we've never been given the opportunity to go and we can supply that for you. So looking at COVID, so COVID didn't really have any impact on our service provision because we're set up that we can provide our service regardless. So we're all home working just now, but it did have a significant impact on the demand of our helpline. So the first week when we went into lockdown, we had a 262% increase in demand. We're sitting just now about 101% increase. But the thing that we do see a huge difference in is we're seeing a 407% increase in people who use substances coming through our helpline looking for help. You know, so we've got then an opportunity to have a conversation with individuals. Kirsten came and floated the idea with us to see if we would like to be involved in providing naloxone kits to individuals, and we absolutely jumped on the chance. So a meeting with Kirsten and our chief exec, Justina, and within 2 weeks we had our naloxone service up and running. So basically that was putting our content available on our webpage and getting an online secure form for people to go online, put their details in and request that kit. So you can come through our helpline. So if you're coming through our helpline advisors will have a conversation with you about the benefits of having naloxone, the signs and symptoms of overdose, and how you can actually use it. So it's like having a brief intervention and a small training session. We also then provide them with follow-up information, so access to the SDF e-learning and also other information with regards to naloxone. If you're coming through our online service, individuals put their details in and they have to click that they've actually been trained in the administering of naloxone. So that's either through the SDF e-learning, they've clicked the link and they've went through the e-learning, or they've been trained in another manner. If they don't tick that box, they must enter contact details. So when that comes through to the helpline, either myself or one of our family support workers will phone that individual or get in touch with them via email so that we can provide brief training on the signs and symptoms of overdose and how to administer naloxone, and that they've also got additional follow-on information. So when our kits go out, we've obviously got the naloxone kit. We do include the kind of pre-noxide injection leaflet, but we're also looking to see of who is the demographic that's contacting us. Is it a family member? What additional information might they find beneficial? So through COVID, There are emergency assistance hubs, there are family support services online, so different bits of information that we find might be beneficial for that individual. If it's a person at risk of overdose, we've got a wee online directory that we know of local services which are still up and running, and we're actually taking information with regards to recovery services, recovery activities, where they can get food, where they can get wellbeing support, and including that in their kit. So not only are they getting a naloxone kit, they're getting the instruction leaflet, they're getting more rounded information of where they can access support for various different things in their local community. So since our service started, so it started on the 25th of May, so we're just over a month into it, and we've issued 53 kits so far. So we've actually issued kits across 18 ADP areas, and that includes 5 people at risk of overdose, 19 family or friends who may witness an overdose, and 29 service workers. So we're kind of monitoring where the service workers coming from. So they're not predominantly from drug or alcohol related services, they tend to be coming from community, community volunteers or different demographics. We've had ScotRail, we've got a security guard that comes through. So 34 of the kits that we've issued are a first supply. 17 are a repeat supply, and 11 of those have been used on another in that time frame that we've been issuing the kits, and 2 have been issued as a spare supply. So how did the people come through? So 7 of them have come through actual helpline calls that we've been speaking to family members to say you'd benefit from accessing this, and 49 have been requested through our secure online portal. So what we've noticed is that since the start of it, we've actually had an individual who's on their 4th issue of a naloxone kit, and that's an individual who's working as part of a community outreach food bank emergency response to the COVID, and they're on their 4th issue of kit, and the previous 3 have been used on another individual. And we've actually got an individual who's come through and is on their 3rd issue of kit, and that individual is a security guard that's working in a retail park. So it's really good to be able to give people who generally wouldn't have access to naloxone to have that in their pocket, and they've got the opportunity there to save a life. So looking at some of the feedback that we've had regards to our service, feedback is staff are very helpful in giving me greater knowledge of my son's drug use and how he may overdose. I never realised I could prevent that. I assumed that when the time came that would be that. And family members really don't think that there's much that they can do. They think that if the individual's going to overdose, then external services need to be coming in. We need to be looking for ambulance. They don't realise that they've got that opportunity to make that small intervention. We've got a lady who goes to a family support service who came through our online service, and she said, even though I go to a family support group and I've been offered naloxone in the past, I've always said no. I didn't want people to know how bad my son really was. Now I have it as a safety blanket and nobody knows. So the stigma associated with regards to substance use, even though a family member is being supported by another service, there's still the stigma of your son must be really bad if you need access to a naloxone kit, and now we've managed to kind of break down that barrier for her to be able to access it. So another one was being able to access a kit without anybody knowing is a godsend. Living in a small island community, word gets round quickly. When it arrived, it just looked like my usual eBay purchases. So we're sending them out and just in a plain white jiffy, and we've actually discovered that we can go online and do a kind of click and drop. We can buy our postal online, and we just need to pop them through the post box. We don't actually physically have to go to a post office to send these out. And the last feedback is, I have requested repeat supplies. I've had to use them on community members. The staff have been great, offering me support and linking me in with local services so I can try and encourage people to get help earlier, as I see them regularly around my work. So this is us being able to kind of link other people into looking at how they can prevent drug-related deaths. So they've got it in their pocket should they need it, but when they're seeing individuals regularly in their day-to-day jobs, how can they have a conversation with them and open up that conversation and try and get them linked with the services? So we're finding that it's been very well received by individuals, and it's just great to be able to have that opportunity to say we've got it here and we can send it out to you. And that's me for today.
Thanks, Suze. I think I'm probably not the only one that was smiling and nodding throughout that whole presentation, and I have to say Sometimes in this work, things can be quite frustrating and you feel like you're hitting your head off a brick wall a lot of times trying to get different bits of projects moving. But this was like the ultimate dream team setting up this postal service with SPAD. It was just a quick Zoom call or Teams or whatever we used, a quick conversation, got the kits ordered, and Suze did all the background work getting that set up. So it sounds like it's having fantastic results, and we're really, really pleased that that's come out of this period. So whilst there are lots of things that are not going well just now, you can see real innovation in some other projects. So thanks for that, and we'll come back to it then for questions, Suze. So now we're going to move on to Gary Rutherford, who's Patient Safety Manager for the Scottish Ambulance Service. So Gary, you can come and join me, thanks. And so the Scottish Ambulance Service involvement in naloxone has been something that we have advocated for years, particularly because we know that people who are likely to die from an overdose have had multiple near fatal overdoses, and the ambulance service are in a prime position when they are in attendance at a near fatal overdose to be able to provide a naloxone kit right at the point of their intervention, not only to the person who's overdosed, but to people who might be on the scene. So it's a bit of a sneaky one because it wasn't started during the COVID crisis, but certainly your test of change was happening during COVID. So over to you, Gary, to tell us a bit more about that. Thank you.
Thanks, Kirsten, and thanks very much for inviting me along to chat about our current and possibly future roles in assisting manage sort of Scotland's challenge in relation to drug-related deaths. Andy, can you pop the first slide up, please? Just a little bit of background. We're a national special health board, although we do split ourselves into 3 regional areas. And our treble 9 demand each day is roughly around about 2,500 calls, and each of them are categorised into what the main reason for the call is. And we receive quite a number of calls that are categorised as for overdose or poisoning. And there's possibly about 20,000 of those each year, although not all related to use of illicit drugs. There's other reasons and household products in there as well. We also have about 3,000 frontline ambulance clinicians. That's both ambulance paramedics and ambulance technicians, and they have naloxone as part of their medicine bag that they can administer when someone is confirmed or suspected to be experiencing the effects of opiate substances. And that happens around about 5,000 times a year. We respond to about 5,000 calls a year where we administer naloxone, although they're not all related to opiate overdose. We also do some work in relation to linking in with health boards, where we make the health boards or the local treatment services aware that we have responded to somebody in the previous 24 hours so that those treatment services can make contact with them. And the card down at the bottom there is an example of the card that we give out to people to let them know that we're going to do that, and should they wish for that not to happen, there's a number for them to contact. And then just around about this time last year, the report came out on Scotland's drug-related death numbers, and it triggered some further thoughts on how the ambulance service could possibly help. Could you pop the next slide up, please, Andy? Probably the first things that we done was go back and have a wee look at our naloxone administration. So this is when ambulance clinicians are administering it. And we can see that over a 4-year period, their own administration had a bit of an upward trend that was similar to the upward trend of death rates that was in the report. Next slide, please, Andy. And also around about that time as well, the task force was being established, and the ambulance service were invited to be represented on the task force. And through that, there was some discussions around about whether the ambulance service could participate in issuing take-home naloxone kits. So we launched a small trial in the Glasgow area, and there were 7 paramedics that participated in the Scottish Drug Forum e-learning that was topped up with some bespoke excellent training from Kirsten. And while paramedics and technicians are quite familiar with naloxone because it is a medication that they can administer themselves, the training and education focus a little bit more on the wider aspects of Scotland's take-home naloxone programme. Yeah, and Kirsten's right. We started looking at this in January and February, and then obviously COVID really started to hit us in March. But I'm not convinced it made a big difference to the actual pilot. We did have some challenges when there were a couple of members of staff not being at work, and the 999 demand profile changed for us fairly significantly during March and April. But we did still, over a period of a few weeks, we did still issue 10 take-home naloxone kits. They were mostly given out to either friends or family or other service workers that were on scene at the time. And maybe we just need to give that a little bit more thought as to whether the person who's experiencing the overdose, if it's how easy it is to get them to accept the kit. But that's something that we're going to think about for the next stage of the trial. We have had some very positive feedback from the paramedics who participated in the pilot to say that they found it relatively easy to give the kits out, and they didn't see any significant barriers at all. The next slide, please, Andy. So that kind of brings us to a point of considering what the next steps for us are. The analogy is that it takes a system to save a life, and what we are currently considering is where we fit in within that system across Scotland and how we can enhance our role in it. We're certainly making plans to extend our take-home naloxone programme across other areas of Scotland, and we're also considering how we play a wider role through local engagement with treatment services and those referral pathways, and understanding the demographics and the data from the people that we attend to inform our next steps. We feel we've got quite a unique opportunity to reach into this vulnerable group, because they or their friends and family are phoning us really at a point of crisis. And it's possible that not all of the people that we respond to will be known to treatment services. So we think we've got a unique opportunity both to give out take-home naloxone and also to signpost people to services and link services in with people who need them. And next slide, please, Andy. I'd be quite keen to, I'm happy to answer any questions, but I'm also keen to establish some links across Scotland with some drug treatment and support services. And if there's any other UK ambulance service colleagues that are listening today, I'd be quite keen to establish some links, and the Scottish Drug Forum can help link us up. That's me, Kirsten.
Thanks, Gary. That's great. And yeah, very quick to time there, so enough to remind you about the timing there. But yeah, we're really pleased to have this service up and running, and we're really hopeful that that can be extended to other areas in Scotland. It's definitely something that a lot of areas talk to us about. And particularly that stuff that you were mentioning there about information sharing protocols and being able to get those near fatal overdose pathways in place so that people can be linked with even harm reduction services to access further information. And we've seen some great examples about how those pathways work in other areas, but there definitely needs to be something done so that all areas have the opportunity to access that type of service. So what I'm going to do now is just invite everybody back on, including my colleague Austin, who has been gathering all the questions in the background, and we will get a look at those. Austin, are you with us?
I think I am.
You are? Yep.
Good afternoon. Yeah, so great. We've got quite a few questions, and people should still feel free to provide more questions and comments. I've tried to group questions together and kind of theme them a little, and some of them are for particular speakers, but I'll trust you to handle that, Kirsten. I suppose there's a request for more information about establishing a postal naloxone service and what's actually involved. Do you need permissions? And how does that feel? And so there's been a few people asking about that kind of more detail on that.
Okay, thanks. So obviously Sarah and Suze are delivering postal services, so maybe come to you, Suze, first, if you could just talk to
Right, so when people are coming through our online portal, so it's a page and it's got the link to the training. So if you go into our website, above it says services. If you click on that, you'll see the Naloxone take-home service. And people can come through that, can access to training, but also when they go into the form, so it's a secure form where they put their details in and it's sent to us with a password on it through to ourselves. They actually have to consent that their details can be recorded because we provide information back to ISD. So by them filling in that form and ticking that they consent, we can record their details and we've got their permission to send that information out to them. Likewise, if it's our helpline advisors who are speaking to an individual, we get their verbal consent and it's put on an online referral form, so the box is ticked and we've got the consent to keep their details and share their details, which is shared with ISD on a quarterly basis. It's anonymised data, just kind of postcode, location, age, and whether it was a person at risk, a family member or a service user.
And I think another aspect to yours, just on the practical side, was you're just delivering this from your house. So, like, obviously it'll be different from some services, and we'll hear Sarah's postal service in a second, but like you just basically had to go and purchase the envelopes and you got the naloxone kits sent to you at your house and you're able just to send them out. And you said that now you've developed some way of just putting them through the post box rather than having to take them to the post office.
Yeah, so I had to go and wait in the massive queue where everybody was hating you because you had like 15 parcels to be weighed and checked. But there's actually now, the lady at the post office said to me, there's a thing that they're doing for people who send large volumes of postage. It's called click and drop. So you can go into the Royal Mail website and just follow the process, and you basically print off the label and you just assign it to the front. So because it's classed as like a small parcel, it does fit in the post box. So you can just tape the postage onto the front of it and just drop them into a post box. I don't have to physically go to the post office. So we just went on Amazon and ordered the A5 padded Jiffy bags. You got me obviously the kits and the leaflets, and then you shared your training information with us so that we can then go on and provide kind of brief intervention and training with individuals. And through the information that we're collating through our kind of COVID service directory, that's why we're able to get other information to include that in that, so folk are not just getting a kit, they're getting other wider information. So yeah, the box sits on the floor at my feet and at my desk, and I just sit here, pick a kit up, pick up an envelope and off the toddle. The post box is 4 doors down from my house, so I'm winning.
Perfect. Thanks, Sarah.
Yeah, so we have a postal naloxone service, and we also have postal IEP in Tayside. So that is funded by a harm reduction and bloodborne virus MCN. So like Suze, they've gone and organised this click and drop. So we have all of the pre-printed, prepaid postal requirements. Now, there are certain requirements for posting medication through the postal service, so it's things like it has to be in a specific envelope, so it has to be padded. You have to have your service name attached to it on the outside. So again, it's having that conversation with the service, as well thinking about what it is that information you're putting on that. So we try and we meet all the requirements, but we also kind of keep that confidentiality, so it's not really obvious to the postie putting that through somebody's door. But yeah, if the services are interested in doing postal naloxone, please do speak to your local naloxone leads and they'll be more than happy to guide you through that. And if you don't know who your local lead is, if you get in touch with SDF, they will point you in the right direction.
Thanks, Sarah. And how do people in Tayside access your postal service? Are staff phoning up people in services that access services, or how does it work?
Yeah, so we have 2 ways. So we have an online for IEP, but we took with the decision with naloxone because we wanted to ensure that people had that training and did know how to recognise signs. That there's 2 phone numbers that they can phone. One is Hillcrest Futures and the other is We Are With You, and they man those phone lines. If somebody's short of credit and things, they will phone them back as well, and they go through that similar process a little bit speeded up. And we also make sure that information sheets go out with the naloxone as well.
Great, thank you. Austin?
Excuse me, I'll unmute myself. The optimistic questions and issues, I suppose, are what often comes up with naloxone is, can we do something more than naloxone? So one of the questions is about using administration in naloxone to identify people who are vulnerable, obviously, to overdose, but to other stuff, and engaging people with services. And so how do we, is there a process for doing that, or have people ideas about how we could use that initial administration of naloxone to do a more profound intervention and offer people other supports?
Thanks, Austin. Susan, I'm going to come to you first because you were talking earlier about a lot of your staff having experience of administering naloxone, and how does that work in your service?
So we have really good links with the Edinburgh Access Practice and Spittle Street. So if we had any concerns around that, we would be linking people in with those services. And particularly just now, because of COVID, we have the drop-in that I had mentioned during the presentation that Jyoti and Lynn are there. So if we have any concerns, that we can encourage people to speak to Jo and Lynn.
Thank you. And Gary, you were talking about the near fatal overdose pathways, and specifically the Tayside, sorry, not Tayside, Forth Valley card that you showed there. Do you have?
Yeah, I think the ambulance service, we really do see ourselves as we could be the eyes and ears out in the community, and potentially identifying people that are in services that have had an overdose. The Forth Valley one is one that works particularly well, and there are others who work as well. And different health boards utilise different support services thereafter to interact with people. But I really do think that we could open up the door to a number of people in the community that are maybe not in support services. Yeah, and I think in events, what happens next is kind of slightly out with my remit of expertise. But yeah, we feel that we've got quite a tap that we could open up if we can get those support services, if we can link in with those support services as well.
Thanks, Gary. Are you able to share anything on the Dundee work on near fatal overdoses, the daily huddles and stuff that were happening?
Yeah, so within Tayside, and particularly asking about Dundee, there is a non-fatal overdose pathway. So any information about somebody experiencing overdose comes from either the Scottish Ambulance Service, or it comes through a report if the police attend as well. And there's very much a team approach around that. So there's a daily huddle, and we have organisations around that. So we have third sector, we have non-drug treatment services as well. So a couple of those organisations were going on outreach, but at that time couldn't actually give out naloxone. They now can. And it's very much about offering that individual the right service. So perhaps treatment services might not be right at that time, but one of the other third sector partners could work with them until that time is right. But it's also about the families as well. So I know that the police in Tayside as well, when they attend, they not only provide support to that individual, but any bystanders as well. They get information about who they can get in touch with. And I know it's certainly family members, they're very good at getting people in touch with Scottish families as well. So it really is that kind of whole approach, and just making sure that people know that there's services out there for everybody.
Thanks. And that's a really responsive service, isn't it? Because it's reviewing any overdoses that have occurred in the 24 hours prior to your meeting, and then people are followed up immediately by outreach workers.
Absolutely, and it's not just closed that day, it's followed up for what the outcomes are as well, and and they will keep going until eventually we kind of manage to get somebody into a service. Yes.
Great, thank you. Austin?
Regular viewers will know I do that every week. Yeah, and one of the other emphases, I suppose, is to increase supply. So there's two questions: one about increasing supply through more targeted work with families and how that could be expanded, and the other one is about, if you like, public supply. So there could be publicly available naloxone, as there are for defibrillator machines and so on. Is that potentially possible, or legal, or desirable?
Thanks. So Suzie, I'll obviously come to you first about the families side and increasing access to families. Clearly the Postal Service does that, but any other thoughts on how else we can access families better with naloxone?
We would like to see anybody that provides any support for family members obviously being able to provide a kit there and then, because we do try and encourage family members. A lot of them, I'd probably say about 95% of the people who come through our helpline are not looking for help for themselves. They want their loved one, sort of like, somebody fixes my loved one, I'll be okay. And they don't realise that, we say all the time that their love has power. You know, the fact that they love and care for that individual can put, you know, safety measures in place and can try and encourage that loved one to change their behaviours. So we would strongly encourage anybody who provides any support or has any contact with family members to have a strong conversation with them and really encourage them to have access to a naloxone kit, because it really does make a difference.
Thanks. And on the issue of publicly available naloxone as well, I mean, I think it needs to be so easily accessible regardless of where you are. So obviously we encourage anyone who's likely to witness an overdose to make sure that you are carrying it on your person. And since the regulations were changed in 2015, it made it much broader for who could be that person who is likely to witness an overdose. So I would say, to the extent, even if you live in an area where you know that there are overdoses occurring in the vicinity, or you walk through areas where overdoses are occurring and there's public injecting, you are a person who's likely to witness an overdose, so you can access a kit. We've also, there's some national work ongoing just now to try and make sure that all pharmacies stock naloxone for use in an emergency, so it's a natural place that people would run to if they came across somebody and there was a pharmacy nearby to get a kit. We have just sent out a whole load of naloxone is available here stickers across the country, and we hope to see them up. Maybe Suzie, you'll have one in your living room window, I don't know. Yeah, so anywhere where naloxone can be accessed, we hope to see those stickers available just to raise awareness of it. But I don't know if anybody else on the panel has thoughts about the public access. I'll just leave it open if anybody wants to chip in there.
I think it's really important, and I think that it's really important that we tackle that, and it would help with the stigma as well, that if we normalise being able to access naloxone as we do any other first aid intervention, then that would really help to tackle it. Yeah,
thanks. And we're having some discussion this morning. Sorry, Gary.
I was just going to say that we tap into somebody mentioned the network of the public access defibrillators, and we tap into that when people phone us. So there's probably a bit of work to be done, but the concept of a national network of naloxone that could be that we could signpost people to when they phone 999 is workable in another way. Yes.
Yeah, that sounds good, and there is some work being looked at in the States. They have this Nalox box thing, and it's basically on that type of idea where publicly accessible defibs are. It's just a naloxone box in the same way, and potential for that maybe like in train stations or other hotspots where you would have defibs available. Yeah, I think there's definite potential. I'd also like to see the medicines reclassification of naloxone away from a prescription-only medicine, and I think that would free up some of its availability. Sarah, you're the only one that's not come in, so I'll give you an opportunity if there's anything you want to add to that question.
Yeah, I would just add to that for community pharmacies, we do have evidence that people are using community pharmacies. I know that Glasgow's had a lot of people running in and getting kits, and just 2 weeks ago I had a pharmacy up in Arbroath who were holding naloxone to say that somebody had come in because somebody had collapsed down the corner. So I think it really does evidence we do need it on the high street, and you're absolutely right, Susan, it does get past this stigma. If people are seeing that sign on the windows and people are talking about it more and it becomes more normalised, it'll help with our supplies as well. So I think it's really important.
Yeah, for sure, and that's similar in other areas with the pharmacies. So so many times in Glasgow we hear cases of pharmacies and pharmacy staff having ran out of the shop and administered naloxone as well. So I think that must happen in a lot of areas. Thanks. Austin?
And hopefully a straightforward question, is supply to somebody under 18 legal, and is there implications there or things that should be taken into consideration? So
in Scotland it's 16, in the UK it's 16, so you can access naloxone from 16 years plus. What's the second part of that? Any implication? So if you can't actually supply naloxone to anyone who's under 16, but you could administer it to them. You wouldn't know their age. Essentially, if somebody was overdosed, you might not know how old they were if they were under 16. So I don't know, Sarah, if you want to add anything to that, given that you're the pharmacist here.
Just to add that the intranasal naloxone Nixoid is aged 14 years and up.
Yes.
So that gives that opportunity as well for that 14 to 16 age group as well. But yeah, I think you also need to think about the responsibility that you're placing on that younger person if you're making that supply and it's for a family member, you know, and it's a really difficult choice to make, but you need to weigh up kind of the consequences and the responsibility that you're placing on that person as well by making that supply, and it's an individual decision.
Yeah, I've had some interesting conversations about young carers and people having access to naloxone as a young person, and I've probably heard both sides. So some young people absolutely would jump at the chance to have something like that because the worst thing that could possibly happen to them would be their parent dying. And the other side of things about that pressure side, and don't young people not being sure that they would want that responsibility of, you know, having something else to worry about. But so I think it goes both ways. I've definitely heard both sides of the conversation, but probably the majority would say that they are caring for their parent a lot of the time anyway. So this would be something additional. If it could save their life, they would absolutely be happy having it. Austin?
Yeah, and one of the other questions is about peer supply. So there's been various areas of established that kind of service. So is there any plans to roll that out or develop that in local areas?
So I'll take prerogative since I've got the chair position. I'll go first and then I'll pass it round. But yeah, so the peer supply started in Glasgow in 2017, and from the 2015 regulations, it is entirely possible to involve peers in the supply of naloxone. It's been quite slow, so the Glasgow peer supply model was amazing. The people involved in that did some fantastic work. We tried to establish it in some other areas and it wasn't quite so successful. It really needs some committed staff as well to be supporting it, and I think that's an important element of it, rather than it just being notched onto somebody's job and them not having the time to support peers, provide a bit of supervision, and with all the logistical side of it as well. We're having a meeting with Scottish Naloxone leads next week to explore the development of peer distribution in Scotland. Susan, you mentioned about the project that's literally just got up and running in Midlothian. I don't know if you want to talk a bit more about, I'm not going to tell you have to explain their project since it's not yours, but your thoughts around expanding that you were mentioning.
I've spoke to Tracy quite a lot about the peer-to-peer naloxone programme, and it's something that we would like to do. And just hearing some of the feedback, some of the amazing work that's happening already there with Malky being able to give it out, and there's definitely something around that peer-to-peer relationship that we need to acknowledge, and we've seen that firsthand through the SHARP study within the centre. We would be really, really keen, and I know that Tracy's offered to help us out just based on the work that she's done there, and we would also have support from our addictions team within the organisation. But I think it absolutely makes sense to be able to do it, yeah.
For sure, thanks. Sarah, any plans in Tayside?
Yeah, so we do have peer supply in Tayside. It's slightly hidden because it's reported through our third sector organisations, but quite often they volunteer with the third sector. So we do have active peers within Tayside, and again we're joining the development day next week, and I think we've got 8 peers from Tayside joining that as well as myself, so that's really exciting.
Brilliant, thanks. Suze, what about like family support groups that run in their own right? Do you think there's potential for them to also be distributing naloxone to other family members?
Absolutely. You know, obviously we have a picture of what family support looks across Scotland, and it is a bit of a postcode lottery as to where you live as to what level of support you can get, but we would very much be encouraging of anybody who's in that kind of support network to be taking this forward. And even if they were the ones who were encouraging the family members to take the naloxone kit and we provided it, but we would very much welcome that family member having a conversation with a family member. There is a family member that's heavily involved in the Midlothian peer supply that's going to take that forward, and we supported Sandra initially set up her group. But that all kind of came about from a family member who'd contacted us because they'd been to the local pharmacy looking for a naloxone kit on a Friday and get told that they couldn't get supplied one, so they'd come to us, but there was at the time that we couldn't provide it. So then I had to go to Tracy to get Tracy to try and get a kit for that individual. So she's just totally cut out all the middle bit and just went straight in for it, and it's amazing just to see how quick that can come about. But for the fact that to include families in that, so we're using peers to support people who use drugs, but we're also using a family member to support the wider family. So you've got that better connection and understanding. It is definitely the way forward.
Yeah, oh, that's great. Gary, see, just not on the peer supply issue, but what's your sense of, so since the naloxone programme started in Scotland, there's been almost 60,000 naloxone kits supplied across the country. What is your sense about how often paramedics are attending where naloxone is already on the scene or it's been peer administered? Do you have any thoughts or kind of feedback or sense of that?
So we do see it, but I would say infrequent in relation to the majority of calls. I have done some small audits to try and understand what different pockets of the country look like to us, and if I do a random sample of 20 or 30 cases where we've responded to and administered our own naloxone, then I can probably find 2 or 3 where a take-home naloxone kit has been used, usually around about when support services have been involved, or a pharmacy or something like that.
Okay, great, thanks. And I guess there was some doubts at the start of the programme as well about whether people would actually phone ambulances if naloxone was available, although we haven't seen a decrease in calls, but there will be people who administer naloxone and don't call an ambulance. I mean, that's just natural, so hence maybe why some of those peer administered ones you may not be getting called to, I guess.
Yeah, we don't see any evidence of a decrease in our calls. I think there actually was a paper published a few years ago that suggested that when naloxone is administered, it doesn't influence ambulance response rates or anything like that in Scotland. Yeah,
thank you. Austin, we've probably got time for one more question.
Yeah, sorry, it's the paperwork question. It's the question of what records are kept about supply and how that's kept secure, if there are records, and whether people find that a barrier, either anticipate it as a barrier, it's an actual barrier to rolling out the number of people that are, the range of people that are supplying.
Suze? Sorry.
So we keep statistics, but they're not. It's anonymised data, so it's the location, so the EDP area where the individual lives, whether it's a person at risk, whether it's a family member, whether it's a service worker, whether it's first issue, repeat issue. If it's a repeat issue, why? What happened to the first kit? And then we keep just letters of their name and their date of birth. So from looking at that, you wouldn't be able to kind of pick that and identify that individual from that stats, and that's what we share with ISD. That's the only information we collate. We don't collate any other information other than if they're a service worker. I'm just trying to kind of map what kind of areas of the kind of world do these service workers work in. So we're looking, we can see that they're not predominantly drug or alcohol. We've had driving instructors, we've had ticket inspectors from ScotRail. They're just different people so we can see that we're getting a wider reach than just working your normal kind of drug or alcohol community. And that's the only information that we keep. It's secure on our SharePoint, password protected, and it doesn't go anywhere other than myself to ISD.
Thanks. Sarah?
Yeah, it's similar to Suze. The service that supplies it obviously keeps that information secure and confidential. We do ask when we supply a kit if we can inform the prescriber, because that should be quite helpful for the prescriber to know, but people can refuse that, and if they don't want that, then we don't inform the GP or the prescribing service. But again, we also collate information to ISD, but again, it's not patient identifiable information that we supply, so people should be reassured that it is a confidential service.
Anything different from you, Susan, on that? Is it similar?
Just feel that we were really supported so well by Andrew, and he gave us all the paperwork that we needed to complete to send off, so that the kind of details of date of birth and stuff go to him, whether it's a repeat use or not, or first time supply. All we take within our services if somebody's accessed naloxone, and that's for our records. We wouldn't keep anything personal with their details.
Thanks. And Gary, we've been doing some work just to get the ISD data about supplies for paramedics just firmed up so that we're clear about what's getting recorded there.
Yeah, it's just the same as the others I've described. It would be anonymised data that we share from the take-home naloxone issuing instances. And the other times that we share data is in that 24 hours after, as Sarah's described, with a regional health board. But we have information sharing agreements in place, and as I said, we've given some consideration to consent and opt-out options that are available to the person at that point in time.
Yeah. Okay, thank you very much. So thanks, Austin, for giving us that belter of a last question. Just such a cheerful subject to end on. But yeah, just I'm aware of the time, so just making sure that we don't go over. I just wanted to say a massive thank you to all of our speakers who've joined us today. It's really nice to hear about all these different developments in service. Some fascinating work going on. Thanks so much for giving up your time to do that today. Thanks very much to everyone who's tuned in. If you have missed any of the previous webinars, they will be on SDF's YouTube channel, and this one will also be uploaded there in the next wee while. Thanks to everyone behind the scenes who makes this possible, Austin and his team, Sophie, Andy and Andrew. And yeah, so next week, next Friday, there will be another webinar, again at Friday at 1 o'clock, and this one will be focused on medication-assisted treatment, which is during COVID, which is a fascinating subject to look at. So I hope you can join us then. But for now, thanks a lot, and till next time. Thank you.